So it all starts with rights. The United Nations Convention on the Rights of a Child is a framework for meaningful engagement and the basis for all of our work at the college. The college values all of these rights for children and young people, as written in the United Nations Convention, with a strong RCPCH focus. We look at Article 12, which gives children the right to be involved in decisions that directly affect you. Article 23 states that children and young people with disabilities do have the right to be involved, equal to everyone else. And Article 31 states that children have the right to play, which is really important, as if you're a sick child, you're spending a lot of time in hospital, in clinics, they should still have a normal, happy life being able to play.
So the approach that we take is obviously centred on rights, as you would expect. So Article 12, children and young people have the right to be involved in decisions that affect them. We have children and young people at the centre of our strategy for the college, so they are active in every part of the college, from exams to training to policy to research to corporate events, services, all that kind of stuff.
With regards to the Epilepsy12 audit itself, as you all know, or should know, Epilepsy12 was established in 2009, and obviously it's got the aim of helping the epilepsy services, and continues to help the epilepsy services and those who commission the health services to measure and improve the different quality of care for children and young people who have seizures and have the different types of epilepsy. So new for 2018 and the next 3 years is the Epilepsy12 Youth Advocates Report project, where children, young people and their families will be taking part in different engagement projects and activities to make sure that their views inform and influence both the work of the audit, but also in creating ideas, projects and develop solutions that help improve the lives of the whole family who are living with epilepsy. Because it's not just the young person who has the condition, obviously it impacts the whole family. And obviously it's about getting the voice across from the young person and the family. RCPCH and us are leading this project, and we've been busy finding out what children, young people and the families think about this. The next steps for us will be to create projects to try new ideas and to work with the units all across the UK and the clinics to find out what they've been doing with the children, young people and obviously the families that have been involved.
We have visited 10 different hospital settings in England. We've also worked with Epilepsy Action to go to one of their family events, and we've got a couple more coming up. So we went out and visited as many hospitals as we could fit in a 6-week period. We were overwhelmed with the amount of people that wanted us to come, which is fantastic. So it definitely means that we're going to be doing it again. So if you didn't get a chance to respond to us and say that you wanted us to come, or we didn't get a chance to come to you, then our information is going to be up at the end so that you can get in touch.
For me, what I felt about reading them was that people weren't really afraid to say what they thought, however old they were, which I think is actually really promising. It's you kind of sort of, well, you hear stories of how people are labelled with their epilepsy, but actually when you actually go into a clinic and just speak to them one-on-one, it's really interesting to see that they are just a human being with this condition, and I think that's brilliant that actually we have that confidence with them. They're able to just speak to us, or speak to their nurse, or speak to a member of our team, and that's fantastic. It's quite difficult because when you're reading these things, you kind of think actually there are some sort of quite shocking results, which we'll go into more detail in a minute. But actually, it's good that actually the confidence is still there, that the relationship is there, and I think that's the main thing. Certainly from my experience, the relationship is the most important thing. I experienced that, and it's good that that's in practice.
I think the thing that I found most surprising as well was the people would come out and they'd talk to Emma and Hannah and their nurse, and they'd be really open. But when the children, especially older kind of teenagers coming up to 16, 15, they were worried about speaking to their neurologist or nurse with their parents there, because they didn't want to worry their parents with something they were saying, which is quite interesting, and it's about what Owen was saying about how it does affect the whole family. Their parents were so worried about them not sleeping or stress at school that the kids felt they couldn't actually speak to their neurologist, and they wanted that one-on-one time with them so they could say whatever they liked. And I think that does just reinforce that it is about the whole family. And I think as well it's important for people as they get older to have that relationship with their neurologist or nurse, less with their parents, because when it comes up to transition, if you're used to speaking through your parents and then all of a sudden you go into adult services, you're going to be thrown by the new people, the new surroundings. So giving younger people more of an opportunity and more responsibility, I guess, in their care would be really important as well. The sibling carers came together and created these epilepsy superheroes to tell us what their superhero does to help someone having a seizure. So it was either their sibling or their parent. And young people who were living with epilepsy themselves created a My Health and Me image board and looked at what they needed to help them with their condition. And all these superheroes do amazing things. So Oscar, his superpower is to have air coming out of his hands to help with CPR, and he helps by moving people away when someone's having a seizure and helps them to get to hospital. And this is a sibling carer who's 5 years old. So I think this just shows that young people should be included in the clinic chats and the meetings that the parents have with the child with epilepsy, because these kids are actually helping out with their siblings and their moms, and they should understand what's going on as the epilepsy changes.
Okay, so these questions are all about epilepsy care, see what you think. And then we'll tell you about what we found out from the clinic chats.
So in terms of the first topic, which was contactability, so that's what the programme board said that they wanted us to go and explore. So we were talking in our start of our conversation in clinic chats with children, young people and families about what this meant to them. There was definitely, from what we found, a variation across the services as to what they had access to and what that access then meant to them. They reiterated throughout all of it that epilepsy is 7 days a week and does affect the whole family, and that some of the contactability and access stuff was also about sometimes it isn't possible for the whole family to come to the appointment. It isn't possible for the whole family to come and meet the specialist nurse or the clinical lead or the other services involved. And actually that then means that there isn't as much confidence in the wider family.
So for school support specifically, this is a quote we've had from one of the clinic chats. We've had sort of mixed experiences in relation to the experiences they've had in schools. Some good examples of where sort of specialist nurses or charities have sort of offered sort of good reassurance to staff and students and their families as well. But sort of others, they've had sort of very bad practice, where the schools haven't accepted help at all, and the student has suffered as a result. Compared to the support that I received, I think there's still quite a bit of work to be done, because when I was at school, I couldn't fault the support that I received from my school, from both my schools actually. I had my big seizure when I was diagnosed in year 6, so in the last year of primary education, and they were absolutely brilliant. And then moving to secondary school, it was just absolutely sort of supportive all the way, and that was when I sort of started fundraising and raising awareness.
So the next thing that came up was the massive thing that everyone knows about is mental health with worries and anxieties. So it was more with older people kind of going into their teenage years, and they believed that their epilepsy would stop and it wasn't forever. And a lot of the things that came out from young people was, like we've mentioned before, why do I have it? Will it stop? How long will it last? And then as people got older, towards 17, 18, they were knowing about how much alcohol they can drink. Will they learn to drive? What's the future going to be like if they get a job? Will they be able to cope with the long hours and like commuting and stuff? So I think for mental health and worries, I think just support right from the beginning. If you a newly diagnosed patient, if you let the parents know, they're going to need mental health support, referral to CAM.
The main kind of like feedback from children, young people and families was the need for more access to support groups. and for those to be local to them. So quite a few people mentioned that there isn't one in, like a commutable distance. It could be too far for them to go. Actually, it could be really difficult for them to get there if they've got kind of like challenging epilepsy, where, it's not easy to drive for 30 minutes, 40 minutes to get to the support group. But that really came up, though, from the young people that we were talking to see if they were interested in this kind of project, and also the experience from Rachel and Owen and other young people in the network, is that actually it's really important to have opportunities which also aren't just about your individual epilepsy life. So being able to affect change at a service level, being able to volunteer, so whether that's fundraising or whether that's joining a project like ours, but doing something with a peer group that gets it, but actually you're doing something to help some other people, because that was giving a different sense of empowerment, and also around starting to understand the different parts of it. So it's not just about the fact that actually, this is the drug I'm on and this is what happened at school. It's, starting to share some different experiences and give people access to different skills.
Having access to services in an easy and coordinated way. They came up for families that we spoke to. They wanted to be able to be as clever with their time as possible and to not have to repeat themselves, but also to be able to have different things for different people based on what they need, not just one thing for everyone. So having more help for transition services too, and people are worried about when it will happen, where will they go, what the adult hospital will be like, whether it's going to be sort of different, how it's going to differ to what they've got currently, if they've developed this big sort of relationship with their with their specialist nurse or their consultants at the moment, how it's going to sort of be completely different when they go to adult care, whether they're going to have to change locations. For me, it's the big one there is kind of the transition. It's a difficult one, really. My transition was quite challenging, because at times you have to sort of stay on to sort of the paediatric care. I wasn't quite stable at the time, but I knew I wanted to gain the independence. So there was sort of some uncertainty in there. Obviously, as I mentioned at the beginning, I'd just started using sort of public transport for the first time in the last sort of 12 months, because I wasn't aware how to get around places, because I've never done it before because my condition was so unstable. But having that transition of care, though I didn't want to do it, I wasn't comfortable doing it. I was sort of able to do it. I was actually able to say, yeah, do you know what, I can do this now. And the transition was able to give me that sort of boost of confidence, and I'm now sort of able to get around places, which is quite positive. So yeah, relationships, quick service, and knowing that they always have the time for you is really important.
Practical help came up, which was quite an interesting one. We found that people wanted something they could take away from the clinic to use as resources. So it came up as ways of explaining epilepsy in a leaflet, first aid training that they can use in the future, lifestyle tips for specific diets and managing sleep. That was from the parents. And then young people wanted advice, like we said earlier, about jobs, driving, going out with your friends, drinking alcohol. So I think leaflets would be a good way to access a lot of people, and that way they can save their clinic time for stuff they need to talk about and bring their leaflets home and read them when they get back.
So the positive adult relationships came up across everyone that we spoke to, and just acknowledging that actually that is different for every single person. So that doesn't make commissioning a service very easy, it doesn't make mapping a service very easy, but it's important for us to be talking with individual patients and finding out actually who is their trusted person and how can we bring them in on this story and this conversation. As we've already heard, being able to talk to someone on your own was important for young people especially, so that they had the chance to say, do you know what, I'm really worried about this, and I'm definitely not telling my parents what I'm planning to do for holidays, which might not include all of my meds. So, it's things like that to make sure that they've got space and time to talk that through with someone that can advise and signpost appropriately, and it didn't always need to be from their clinical team. We also heard a lot as well from charities and the support that some of the charities that are here today, so Young Epilepsy and Epilepsy Action, provide to that wider family is important. And also through the helpline stuff, being able to pick up some of those calls to give advice or to reassure if something different has happened?
We want you to just vote now for one thing that you commit to do off our list of questions on Kahoot. It's just one final question. One thing that you commit that you're going to do when you go back to your units.
What we need you to do is work with us, with Open UK Regions, with your teams to tell us your amazing work in these areas, and so we can share it with others and start some new amazing, fantastic projects and activities in these areas, working with children, young people and families. You can also join the And Us Workers Forum, promote our project with your patients, and you can create your own project and maybe even present at next year's conference.